So looking back at my career, I think what I would do differently is I would learn at an earlier age not to sweat the small stuff. I was very hard on myself and I pushed myself, and I feel like some of the best years of my life, especially when my children were small, I was too focused on my career. I volunteer in the community because it gives me great personal energy and blessings. And I know that we are placed on this earth to serve those less fortunate than us. I'm thankful to have the means to serve, and I'm proud to bring my kids along as much as possible. Volunteering in the community has allowed me to interact with so many interesting people and expose my children to life outside their circles. I think the advice that I would give a woman of any age who is entering or re-entering the workforce is never to let anyone tell you that you can't. When I was much younger, earlier in my career, a much older man told me that he didn't see in me the skills that it takes to be a CEO. And I'm glad I proved him wrong. I think I want my legacy to be safer healthcare. Unfortunately, I lost my husband due to a medical error in 2015. My children were small, they were 9 and 11, and I had to explain to them that Daddy wasn't going to wake up and that we should focus on donating his organs. That terrible experience certainly changed me as a person and as a healthcare executive. I hope that my legacy is that healthcare in hospitals is safer. I've shared my story hundreds of times with physicians and healthcare workers and community members, and I hope in turn that patients ask more questions and healthcare workers stop and express concern when something doesn't seem right. If my legacy could be avoiding unnecessary harm or death to just one patient, I would be thrilled. I think when I have to describe with one word what describes me as a successful breakthrough woman, I would say relentless.